Welcome to the Healthspark, Igniting Healthcare Management Change and Evolution. I'm your host, Dr. Gingeraya. Hi, I'm Dr. Gingeraya, and today I have Celeste Nevarez with us. Celeste is a dedicated mental health professional and a healthcare leader. She serves as the Chief of Clinical Services at Emergence Health Network in El Paso, Texas. She has over a decade of experience and has significantly contributed to the mental health sector. Celeste has a master's of counseling. Her degree is from Arizona State University. She has a master of public health degree in healthcare management from UTHealth Houston. And she's also an accomplished educator. She is teaching currently at the University of Texas at El Paso and has taught at El Paso Community College. She's also an esteemed public speaker. I've heard her on the public speaking realm often. You left that out of your bio, and you can also see her online in various video vignettes. I saw your mindful moments where we see you promoting mental health wellness. So welcome, Celeste. So
Thank you so much
Celeste,
for having me.
tell us a little bit about yourself. Tell us about what inspired you to become a therapist and why you chose like this mental health career.
So thank you so much for having me. I really appreciate it, and the hype around public speaking. It's a joy to do. But the reason why I got into therapy, which is, I don't know if I've even told you this story yet, but I actually grew up in my grandmother's beauty salon, and her hair salon in the Lower Valley, Sunset Beauty back in the day. And so I think I've grown up around therapy my whole life. It just wasn't in that form. People say bartenders and hairdressers are the original therapists. So I got to grow up in that environment and got to see, women come in and talk and exchange stories and cry. I mean, I remember just so much being in the salon, and obviously my grandmother was cutting and curling and perming hair, but she was also listening with intention, and not listening to solve, but really just to create a space for that healing process to happen organically. And so it's really exciting to have taken that to a healthcare level. But that's where it all started.
Wow, I didn't know that. That's fascinating. Okay, so tell us how you feel that, so you become a therapist. How then do you go into this leadership capacity? And how does mental health and healthcare management, tie in together? How did you then become a leader in that space?
Yeah, it took some time. I graduated with my first master's of counseling in some time ago. I was 22 though,
Wow.
and it was only last year. Let's be honest. No, so I graduated 22, and I was just trying to find a job, and I was trying to come back to El Paso, and it was horrible. I was fun employed for some time, living at my parents' house again, and it was great. So I couldn't find anything, and that was really tough. So, but found some work, and the rest is history. But as far as moving into a leadership role, I think for me, what was really exciting is I had such great mentorship at Arizona State University. I mean, my two professors who I attribute so much to is because of that. One of them put me up for a job as a graduate student working at the counselor training center. Even though they only accepted PhD students, she was like, you need to interview for it, and push me in that direction. And so I think through that mentorship, I was able to see what that looks like, having somebody cheer you on. And then the ultimate goal is to fill those shoes one day, and hopefully champion other young professionals. But being a 24-year-old lead at a psychiatric hospital and telling people, sometimes twice your age, what to do is not fun, and you learn a lot of lessons that way. But with that comes really great opportunity to see how other people operate and how other people run things. And so it's been fun. I'm really pleased with the fact that I've had the opportunity to move into healthcare leadership, and really hopefully mentor people who are young and new in this career.
Yeah. Well, I'm glad you brought up that point about mentorship, because I feel like not enough people do that. Not enough people continue to mentor and develop other people. And I think you're a great example of that, because I see that in you and within you when you lead other teams, even in your graduate work, but also within your teams at work. So, how have you been able to keep doing that and to embrace mentorship? Because a lot of people see that as a burden and they don't want to keep doing that. So, how have you embraced that?
Yeah, it is. It's a lot of work. It's a lot of work to take time to have, the anxious new hire in your office or the student intern who's not an employee want to spend 45 minutes talking about their career path. Um, but the investment is always, the return on that investment is always significant.
Hmm.
It pays dividends, I believe. So I think carving out the time to do that, not seeing it as a hassle, but really an honor, which I do take. So when people even say that, like, oh, thank you so much for mentoring me, I'm like, oh, I just thought we were having lunch a lot, but cool, that's great. I'm glad that that was helpful for you. And knowing that I always want to send a ladder down. Like, it does me no good to be in this really great lofty chief role if there's nobody else coming in to take my space, right? um, so I think that's important. Succession planning is always really important. Thinking about just a team. There's so much growth in opportunity in having great leaders around you. It makes me a better person. And so investing in that time, I think, is just really important, and it
Awesome.
not feeling like it's a burden. It
Yeah,
is. It's time, but it's not a burden.
I
It's a
love that.
reward.
I love that. Okay, let's talk about integrative mental health and what that means. We just had a capstone where your team won with the concept of integrative mental health. And so, first of all, I just need some education. What is it? Is there a difference between integrative mental health and integrative behavioral health? Is it
No,
interchangeable?
tomato tomato. There'll be
Okay,
people who'll be upset about that, but they're really interchangeable. I think the idea of mental health, some folks say like that's outdated, and behavioral health is like the whole person,
I
right?
see.
Their behavior around it. But I use them both interchangeably. But integrated care is really trying to weave in primary care with behavioral health care. So when you go to your doctor, your primary care doctor, right, they give you all sorts of screenings, they weigh you, they do all this stuff, blood work. But are they asking you how you're feeling emotionally?
Mm,
No, you got to go see a specialist. Go see it. You know what I mean? It's so another silo when the body and the mind are connected by a neck. So why are we not treating that whole person? So integrated care really looks at the whole person, and making behavioral health more accessible with that primary care visit or total care.
right. And so, what do you think some of the challenges are for why that has not been embraced in the past and why it should be? Well,
How much time do we have? No,
mhm.
because ultimately, and people will give you a lot of different reasons, but I think for me, my personal opinion is that it's scary. People are nervous about behavioral health. They feel like if I ask that question, are they going to become suicidal or homicidal, or am I going to
Mm,
open up Pandora's box, and I don't know how to actually treat that. And so I think we've been trying and working really hard to make behavioral health part of that conversation so that it's not something that's terrifying. And I think that comes along with stigma with behavioral health. We put those people in the back, and we just don't look at them like, no. Everybody has behavioral health. If you have a brain, you have behavioral health. And so reducing that stigma has made it a lot easier to integrate that care. But I think there's a lot of fear around taking on something that you can't wrap your arms around.
I get it totally. Um, so I want to ask you about reimbursement rates, and if you think that reimbursement rates impact the way healthcare organizations see integrating behavioral health. Do you think that has a lot to do with it right now?
I think it absolutely has to do with it. Look at healthcare providers. Some folks, this is a hot topic, but some folks don't consider mental health care as healthcare providers. I've been in rooms
Mm,
where I'm like, oh, I'm a healthcare provider. They're like, you're just a therapist. Like,
mm,
so if we do it in that way, as far as healthcare providers, I think therapists are one of the lowest paid healthcare providers
Wow.
salary wise. And I think a lot of that is because of the pay rates, right? I can add on a 30-minute session or visit to my primary care visit, but the reimbursement's only what, 35, $45. Like, is that worth my 35 minutes that I could see 2 other 15-minute visits in there at, 120, 145? Yeah. And it takes time. It's not, it's not a blood line or a blood sample. I can just read through a chart. Like, I have to
Right.
ask questions, and it's
Right.
conversational. So it's a lot
But
of
yet
effort.
there's such a huge shortage in mental health, behavioral health
Mhm.
providers.
Right.
There's a huge shortage.
Huge shortage at all levels. Um, I wouldn't say that's just because of the reimbursement rate, but
Of
I would
course.
say they're absolutely correlated.
Okay, great. Not great, but yeah, totally
Right.
get it. All right. Okay, so let me ask you about, well, before I jump into what healthcare leaders need, as far as innovative approaches, I mean, we've talked about the challenges of implementing integrative uh, behavioral health into primary care, but what do you think are some innovative programs or innovative approaches as to how we look at mental health and behavioral health now?
Well, COVID was tragic and terrible and not a good time, but because of
Mm,
COVID, telehealth has become so much more acceptable and accessible. As I remember, I've been a therapist a long time, but I remember talking about virtual sessions, and they were like, no, it's not HIPAA compliant. That's impossible. It's too difficult, everything. And then we were forced to. And now there's so many online therapy options and
mhm.
platforms and all of that. So I think making healthcare, mental health care accessible is so innovative, because you have to think about people in rural communities, differently abled bodies, people who are in different settings, transportation, non-medical drivers of health, right? It's a transportation issue.
Mm,
I can see somebody now on their lunch break, at work, if they go to a private room, like, they don't have to take an extra 30 minutes to go drive, park, all of that good stuff. So that's been incredibly innovative. And I'm also really happy that I'm seeing more and more the PHQ-9 patient health questionnaire, 9 questions, be introduced more and more into primary care. I know my doctor handed me one, and I was like, I'm so proud of you for asking this, which I know is a role reversal, but um, I'm really happy about that innovation and starting those conversations.
yeah. Tell us what a PHQ-9 is.
Patient health questionnaire, 9 questions to look at major depressive disorder.
Okay, great. And your primary care provider did that.
Mm-hmm. Gold
Awesome.
star for him.
Awesome. Awesome. Okay, great. Okay, so can you share with us any success stories where you've seen the integration of mental health services impact patient outcomes or organizational efficiencies?
Absolutely. So I want to add too, just to add another layer of integrated care, is substance use.
Ah,
Um, Substance use is often separated then from mental health. They're not,
mm,
they're one and the same. I guess behavioral health is more inclusive of that, right? Um, and so if we're asking questions about, your cholesterol and your liver and all of these other things, are we also asking about your alcohol use? And is that tied to some kind of change in your family history? Well, I'm going through a divorce right now. Okay, so that, instead of just giving you a bunch of pills to say this will help the whatever problem is, let's talk about the alcohol use. Can we get you counseling to really reduce the stress that's going along through this divorce and that kind of thing? And so I think integration has been instrumental in that. I mean, I don't have the data in front of me, but then we also talk about, like, at EHN, our first episode psychosis program, where we're working with individuals 13 to 30 who are experiencing the first time psychosis,
mm,
hearing things, seeing things. That's terrifying. Families are scared, the individual's scared. It's also like the ages 13 to 30 is also just terrifying in and of itself.
yeah.
Um, and so we're seeing things like, reduced emergency room visits, so that they're
Mm,
actually being seen by behavioral healthcare providers and not an emergency room physician, which they're great at being an ER doctor, but not the long-term solution for this family.
Sure. And I'm sure that's a huge savings also.
Absolutely.
In the ER. Awesome. Okay, great. So I had mentioned to you that there was an American College of Healthcare Executive survey that went out back in June 2021. So COVID-ish, a little after COVID-ish, that showed the inability of healthcare executives to disconnect or essentially to take care of themselves, right? The survey to me was extremely alarming because it asked healthcare executives at the director level and above if they were able to do things like unplug from email or other work communications during their time off, and 70% of them said they could not. Uh, could they take breaks or moments of respite during the day? 53% of them said they could not. Things like take vacation or time to do other things that they enjoy. 51% said they could not. So the list of horrifying things that healthcare executives were not able to do in relation to the level of job stress that they had was horrific. And what makes this more terrifying for me is that these are healthcare executives. These are people who are leading healthcare organizations. And even though I'm terrified by this data and I'm terrified by the fact that these are individuals that should be very in tune with their own health and with taking care of themselves, I also totally get it and totally understand because they have a higher level of responsibility. They're taking care of them, of their organization, they're taking care of their providers, they're taking care of their teams, they're taking care of their patients, and ultimately the success of that organization. So it's easy, I'm thinking, for them to say, I'm going to put myself second or third or fourth, and then their families, and the list goes on and on and on and on as to why they can't unplug or why they can't take a vacation or care for self. So, and I sent you the article and the survey so that you could look at it. When you look at that, how important is it for healthcare leaders to prioritize not only their own mental health, but for them to have strategies to maintain positive or just optimal well-being levels in their environments? So how can we emphasize for healthcare leaders for them to take care of themselves and also for their culture and for their environment?
Yeah, what stuck out to me, I'm going to try to touch on three things, so I'll try to be
Great.
brief. But the first one is this concept of like wellness, right? Wellness for everybody else but me. That doesn't make sense. It's incongruent. And then the second one is really this notion of like, I can't take vacation. Is it that you can't or that you won't? There's a choice involved, right? And going back to my original, what you talked about, like mentorship, if I've built a team of leaders around me that can take the work, I can take that time off of work. So that's that cashing in, right, on that time spent. Because when I'm out on vacation, not only do I know that they can do the job, they know how I would want it done, right?
Absolutely.
There's no secret about that because we've spent the time talking about that. So that if that's not a plug for mentorship, I don't know what else will. You can go on vacation if you do it.
That's right.
And then what I love finally is what's different about being a therapist from maybe other healthcare providers is this idea of emotional competency. So part of my role as a licensed professional counselor is my ethics. And that's my favorite topic on the planet. I'm an ethics professor. I love it. So part of my ethics, part of my duty and responsibility in being a provider is that I have, I can't overcharge my clients, I can't be late, I can't ghost them, all those things. But one of them is I also have to maintain emotional competency. Or otherwise I'm being unethical. And that's something that's built into our language. And I love that because if somebody is, we'll use a divorce thing again, like if somebody's going through divorce, should they be seeing couple therapy? Maybe not, because then the answer is like, just get divorced. We're all doing it, which you don't want to hear your couple therapist say. So we have that built in, and I love that about our role and our work. And we have such candid conversations about that to where I can have, even with my staff, like, hey, that email you just sent was a little spicy. What's going on? Because it's part of our duty to be ethical therapists. And so so because of that, we're intentional about it. But I would go, when I was reading through the article, again, that is it that you can't or that you won't? Is it that you've got support from not even just your peers, but your direct reports? And are you modeling that for your other future healthcare leaders, right? Like, if everybody sees you always going, and they're not going to request time off, so then they're frustrated and burnt out, builds into resentment. So then we just got this culture of really angry, frustrated group of people. How successful is that? And how great are patient quality outcomes if everybody's in a terrible, grumpy mood?
Totally.
Not great.
Totally. I totally agree. I love that. All right, great. So let's wrap up with final words of wisdom. What would be one piece of advice or wisdom that you would like to share with others listening or others that are aspiring to make a difference either in the mental health or behavioral space or the healthcare industry in general?
So I have two. One of them involves a bad word or a curse word, not a bad word. Do no harm, take no
I got it.
trash. We'll say.
Yeah.
It's really helpful. So do no harm, but also taking care of yourself, right?
Love
like
it.
This notion of I always need to be of service, which I feel I am, but also like I'm still a person and I need to be treated as such. And then the other one is if you do not take time off will find you.
I love that.
It's when you're in budget season and then you get hit with a cold, or it's your daughter's, I don't know, quinceañera, and you roll your ankle and break it because you weren't paying attention, and now you can't wear the shoes you wanted to wear. So taking the time off, or it will find you.
I love that. I love that. Well, thanks so much, Celeste, for joining us. I'm going to include your bio and your socials so that people can find you. And I look forward to seeing your career continue to grow and all the awesome things that you keep doing.
Thank you. And thank you for helping be a part of it and helping me grow.
Thanks so much. Thanks for listening to the Healthspark, Igniting Healthcare Management Change and Evolution. Please look out for future episodes and follow us on our social media pages.